My name is Dr. Daniel Frayne, and I'm a practicing family physician and the president of the Mountain Area Health Education Center. I'm also a partner to the March of Dimes on a regional, state, and national level. The March of Dimes has been promoting a concept called a circle of care. We know that women need a circle of care. Our statistics around infant mortality and maternal mortality are not where we would want them to be, and they've been that way for decades. What we know now is that we need to be doing something different to care better for women. Women need to be at the center of our healthcare system, and right now they're not. Doing things differently means designing our healthcare visits as physicians and designing our resources that are directed towards women and mothers in a different way. We have an opportunity to open conversations about their health in ways that we haven't traditionally done. In the traditional model, we often focus on reproductive health or pre-pregnancy planning or pregnancy care only when that presents from the woman's side. These conversations often don't present themselves. We know that over 50% of pregnancies are surprises, and so the opportunity to plan a healthy pregnancy doesn't exist for a majority of people. Most of our efforts and our resources are devoted to prenatal care, and although that's very important, in order to get different birth outcomes and to improve infant mortality and to improve maternal mortality, we need to focus on the woman's health before pregnancy, in between pregnancy, and beyond pregnancy. We have many different opportunities to have these conversations. The key is we need to have the conversation. We need to ask questions when women present themselves to care, regardless of what the reason is for coming to care. We have opportunities in acute care. We have opportunities in chronic disease management. We have opportunities in well woman care. And we have opportunities in pediatric care when women are bringing their children for care. A woman's health really drives the health of the community. It determines the infant's well-being in the first years of life. It determines the family's well-being. It determines the future chronic diseases that we see in adulthood. A woman's health really needs to be at the center of our healthcare system. But again, this often is not the case. And so coming back to an idea of circle of care, we need to do something different to really have a system that creates resources and opportunities for women to receive the care that they deserve. Preconception health is not just for women who are planning pregnancies. Preconception health is about reproductive well-being, both for her and for the future generation. It involves all aspects of her health, both physical, emotional, and environmental. These are areas such as nutrition and weight, multivitamins, about behaviors such as smoking or alcohol, and how to address cutting down or stopping when appropriate. It involves chronic disease management and medications that are being used appropriately, whether or not she is desiring pregnancy or not desiring pregnancy. It involves really addressing pregnancy intention and contraception use, as well as birth spacing. It involves mental health, depression screening, and intimate partner violence screening. Many of these things we do frequently, but often we're stuck in a model that just checks a box. This shouldn't be about checking a box. This should be about opening a conversation with women and how we can participate in achieving their health goals. A reproductive life plan is just that, is being able to open a discussion with women about their goals and how we might be supportive in helping them achieve them. The opportunistic approach of asking women every time we have the chance about their pregnancy intention, their health goals, their reproductive goals, their mental well-being. These are the opportunities to do things differently. We hope that you will join the March of Dimes in designing your healthcare visit, your interaction with women, wherever that visit takes place, whether in a doctor's office or in a social service agency or in a pediatric office, in a WIC office, wherever women are receiving care, these concepts could be utilized to create that circle of care model. We will give lots of examples about ways of doing this that are woman-centered, that are engaging, that use the concepts of shared decision-making, and that are simple and focused. You don't necessarily have to solve all of the issues in one visit. The key is open the conversation. Don't just check a box. Work with women to achieve their goals, and we will get a different result. Thank you for your time, and I look forward to partnering with you in designing different ways of caring for women.